Healthcare Transformation Coalition Symposium is to draw up critical areas of need for the healthcare sector and ways of achieving them. Speaking, the Minister of Health, Dr. Sage Haniri, says minimum package for health to all citizens of Nigeria is required irrespective of the investment in the sector, while the DG NCDC speaks on increased surveillance against outbreak of diseases.
That no matter how much you have invested in health, if half of the population has no access to healthcare, then there's something wrong with your system and we are not doing it right. So we need to make the health services available to aspirationally 100% of our citizens. It's possible to have a basic minimum package of healthcare.
We have to strengthen surveillance, and surveillance has been mentioned by somebody earlier. It's not a national government or NCDC thing. It starts at community level, and that fits into or is irretrievably linked to ensuring that primary healthcare and universal healthcare works, because diagnosis, identification, early treatment, all of that happens at primary healthcare level. The third bit is, of course, ensuring that now we have a robust supply chain and stockpile.
The former Commissioner for Health, Lagos State, Dr. Jide Idris, and Senator Sabi Abdullahi say the symposium is to outline ways of increasing access to healthcare as well as increasing budgetary allocation for health.
Government has a role, the individuals have a role, we professionals have a role. But over the years too, we always believe that government knows everything. That is not correct. Because government are human beings, they are not healthcare professionals. So it's left to us, we professionals, to show the direction, to tell them what to do or what we want done. Over the years, people shy away from this. We just believe that, and let be frank with ourselves, you cannot have a good health sector if you don't play the politics. This is essentially why this is done. This symposium was organized as part of many activities. One was to mobilize all health workers, friends, colleagues, in getting very political.
Policies that will turn around the health sector. As much as you say the budget is low, there is a fundamental question being asked in this very symposium, which is the funds available, how well are they utilized? And how well have you integrate all the support for the healthcare coming from different sources? And I think that is why one of the panelists was talking about using technology to integrate all sources of financing so that transparency and accountability are introduced.
The symposium on repositioning the healthcare sector outlined preventive and reactive measures to improve the health status of Nigerians. One of the measures agreed is to ensure that primary healthcare centers in all wards are functional. Joseph Kadri, ITV News.